Good morning. Happy Tuesday. It's 9 o'clock or 9:10. Trying to make it so I can maybe get Chick-fil-A, because I have been craving Chick-fil-A probably since December. It's 43 degrees and I'm headed to the lung doctor. If I did not have this appointment, I would still be in the bed. I still have a lot of stuff to get accomplished before tomorrow with the cleaning lady. And I'm just dragging. Last night, I worked on the kitchen. When I say it rains, it pours. Like, the dishwasher went out first. And it did this, like, a couple months ago. Like, where it was just, like, blinking. But then all of a sudden, you kept pushing and it started back. And now it just won't do anything. And the dryer is acting up, like super loud, clunking, squeaking. We have a Samsung washer and dryer, and I think we've had those people to come out at least 4 times since we've had it, and we've had it like 2 years, which is crazy for them to have to come out that many times for something that costs that much money. I think our next purchase, we're about to get the American Home Shield warranty. We've been saying this for like freaking 2 years and we ain't done it. And I was like, we gotta get this done, because you have to let it be in effect for 30 days before you can actually use it to replace appliances. So we really didn't want to replace stuff until we knew we were like gonna be like doing the kitchen over and stuff like that, because we wanted, stainless steel everything, and right now the appliances are white, so I will have a stainless steel dishwasher. I mean, because the stove needs to be replaced. Like, everything in that house, we're pretty sure it's from when the house was built. But yeah, so it's a lot of stuff that we got to get accomplished, that we got to do better to be prepared for that type of stuff. Like, dishwasher is not major to my husband, but it's major to me. So, like, sitting there having to wait, like, I don't feel like drying the dishes by hand, so I'll just let them dry, in the dish drain. And then, like, today, I'll just go through and just dry them off if there is any residual water. But I want the dishwasher. I need a dishwasher. I remember when we were little, I used to always want a dishwasher. My dad said, we already got 3. And I was like, what are you talking about? We don't have a dishwasher. He was like, you, your brother, and your mom. And I was like, thank you, Dad. But yeah, so I should make it to Chick-fil-A. I know they're gonna have a crazy line, but I want some chicken minis. I don't care if I get like 2 bites. Like, I just want some chicken minis. I'm not sure like how this appointment will go, but I will be talking to them about nebulizer, because I still have the low oxygen, the wheezing. I'm not seeing my doctor, which I'm not happy about. I'm seeing a different PA from the other one, because the first one that I saw in their office, she pissed me off and she pissed the doctor off, because I was so sick that day with my oxygen and everything, and she didn't even take the time to call him. She's like, I don't want to give you anything because he's giving you stuff. And I'm like, okay. And he's not here. And he was like, I was at the hospital. She could have called me. So when they said I was seeing a PA again, I was really ticked. I don't know what the heck what the deal is. I prefer them to put in my chart. I'd rather see the doctor, because when it comes to something like, I feel like, don't get me wrong, I've worked with PAs and nurse practitioners that are freaking awesome. Some of them are more amazing and smarter than some doctors. But when it comes to my lungs, with me having, this is my 3rd pulmonologist, and everything that he's talking about, like the tertiary care hospitals taking me there, or all this stuff, like, I prefer him because I hate repeating myself, and then she's gonna have to look at the notes, and then you don't even know if they're really gonna talk to the doctor about your case, because I've worked there, been there, where they don't even communicate with the doctors. If it's not anything like super life-threatening or urgent, they don't communicate. They will literally put it in that note, and your doctor won't know until the next time you come in. And it's a good and I'd say it's not anything good about that, but it's just doctors get so much pressure to see so many patients that if they work in like a network of hospitals, they want them to see 30 patients, and there's no way in the world that you can see that many patients effectively. So it's just kind of stressful when it comes to being in that part. The cold weather, like, even though I have energy, like more energy now and stuff, the cold weather is wreaking havoc on my back. And that's my trouble. It's like being so tired from tossing and turning, changing positions at night. And the medical tincture oil, the medical marijuana tincture oil helps. Don't get me wrong, but not everything's going to take your pain completely away. And for most nights lately, I can sleep through the night, maybe get up one time, but when my back is like this cold weather, I feel like it's like season up, or it's just the joint pain is like extra. But I'm trying to like push through it no matter what. Like 2019 will be better. Like, I've had a horrible, I mean, I'm thankful, but I've been through some stuff, so I just want to be more positive for 2019, and still speak the truth of how you feel, but not letting that consume your entire day and your entire life. So I made it to Chick-fil-A. I ordered and waiting in this long line. Like, their lines are so ridiculously long. I could have got out and went inside, which probably would have been quicker, but no. Normally they let you pay because they have the little order taker standing outside, but she said pay at the window, so I think that's why it's moving a little slower. Even though their lines normally are crazy, like, it normally moves pretty quick. So I don't know why they're not letting her take the payment, which will make it go a whole lot easier for the ones using debit cards. But it's 9:38, so I should have a good 10 minutes to eat before I go into my appointment, which is like pretty much next door to Chick-fil-A almost. But the bad thing is I can only take a right turn out, and it's to the left, so I'll have to like go down, come back up, which is kind of aggravating, but I think being able to eat Chick-fil-A would be worth it.
Hey there.
How are you?
Miss Cheryl?
Mm-hmm.
Okay. All right. I'm Brittany, one of the practitioners here. Nice to meet you. I see you here, right?
Yeah.
So he started you on some asthma medications. Are those working okay? No.
I don't do anything.
Can't do anything. How long did you use them?
Over a month or more. Just, I would only do it, of course, when I was like short of breath or wheezing, but it's like not being able to completely like get a good deep inhale was the issue. So I don't know if like I have a nebulizer, so I don't know.
Now the Advair and
I'm not doing that.
And the Symbicort, how long did you try those?
I tried them for like a week, but I want to say the Symbicort is the one that it made me cough a whole lot worse. So he said I didn't have to really do that one.
Okay.
So I was just doing the Combivent.
Okay. And you're continuing that one?
I haven't.
Okay.
I don't use it. Like, it just isn't. I don't see that it's helping me when I'm in like a short of breath, like attack or whatever. So it's not changing anything.
Okay. These are our inhalers. And so these are our short acting inhalers that we use for shortness of breath and acute attacks. Things like this are long-acting beta 2 bronchodilators. So whereas this is a short-acting, it works for you when you're short of breath. These here are long-acting, so you don't feel relief right away when you take it. These give you relief over time.
Okay.
Usually 2-3 months.
Oh, wow.
Okay. The same thing with like inhaled corticosteroids. All of these here, these are all long-acting medications. These here are combinations of these and these. This one is a combination of this and this. And what he gave you, the Advair and the Symbicort. So this is the Advair right here. And it's an inhaled corticosteroid and a long-acting beta 2.
Okay.
So the long-acting beta 2 and the corticosteroid, that's going to give you relief over time.
Okay.
I know they're not the best at explaining all of this when they give them to you.
No, I worked for a lung doctor before, so I understand.
Okay. So, really, you're going to get the best benefit with using the Advair over months.
Okay.
That's when you would really start to see some benefit from it.
Okay.
Have you done anything else since you've seen us last?
I'm not on any of my lupus treatments. Like, they literally said they don't see it anymore in my system, so I guess I was misdiagnosed. I'm not sure. And that was part of the reason for me seeing him, because I was on oxygen for like 2 years and no one could ever figure out why, other than them saying it's your lupus attacking your lungs. His last thought was exercise-induced cardio or pulmonary hypertension. And he was thinking about sending me to like a tertiary care hospital because he felt like the physicians in this area aren't capable of doing the correct testing. So that's where we left it. But my SAT still dropped, but I mean, they go to like 92. I feel it at 95, like headache. Like, okay, let me stop for a second. And it'll go right back up, but it's still the point of why is it continuing to do that? And I mean, I know asthma is, I had asthma as a child and I outgrew it, never had any issues. And when the, IgG test came back or something, that's when he said, oh, I think it's asthma. I don't think it's asthma. I think it's the effects of the treatments that I was receiving, the infusions for the lupus, because they stopped it at one point because of breathing, and then they resumed it. And he ended up stopping it because he's like, I think that's affecting your lungs.
When was your last treatment for that? Probably
like 6 months ago or more. And my CellCip, they stopped in I think November, the first part of December.
For GI issues?
Well, no, just because the doctor, my new rheumatologist, felt they should have never put me on it. And then that led to her doing the repeat testing and saying, you don't have lupus.
Where did you get your original?
So I was diagnosed in 2014. So kind of angry. It's like you're thankful. It's like, well, I'm healed kind of thing. But at the same time, it's just like 4 years of my life of you pumping all these medications. And I was only getting sicker and sicker. But, you tell her and she would just do nothing. So
I wonder, that's crazy.
Yeah.
Okay, so have you noticed any improvement since you stopped treatment?
A little bit. I just feel like certain days when I'm just like extremely fatigued because my new rheumatologist doctor have fibromyalgia, which of course will contribute to the joint pain and fatigue. But I still get winded. Like some days, like trying to do stuff around the house, I have to like take a break after 10 minutes. And just let my oxygen kind of go back up. And then once that, I rest for about 30 minutes and I get back up and, do what I have to do. But I never felt like, I know asthma can make you, you're short of breath, but I just like to have it desat like that.
Yeah.
I don't really think
Yeah, I mean, I was looking over his note, like with your PFTs and everything, and you know, that was one possibility with how your lungs are acting. But there were a few components that he couldn't really explain of why they were the way they were. So that's why he wanted. Hey, so he's gonna come and see you.
Okay.
Just give him a little bit.
I
I
will.
don't know how long, but I'm gonna switch you over to his schedule.
Okay.
And he'll come in and see
All
you.
right. Thank you so much.
You're welcome.
Hey there.
How are you?
Good. Okay, so what's going on?
So since I last saw you, you stopped the infusion, the Enlista. They stopped my self set. I got a new rheumatologist doctor sent me to.
Yeah.
And she retested me and she said that I don't have lupus. She said that she reviewed all my records from, and she's like, I don't even know why she diagnosed you with lupus in the beginning, because she said I didn't fit all the criteria. So.
Okay, so hold on. I said in my previous note. Okay. PQ negative, don't exercise. Okay. So your DLCO was low. So you've been using anything for your lungs in terms of breathing treatments?
Just the Combivent, but like I told her, I just don't feel like it does anything, so I don't even use it. Like,
so you basically are short of breath.
I'm short of breath. And my stats, I mean, they only get as low as like 92,
But
like
you
I
drop.
can feel it, you know?
But it
yeah.
drops. Well, I mean, I thought about exercising. So exercise-induced pulmonary hypertension happen. All of us, when we exercise, your blood pressure goes up. Okay. Some people have high blood pressure at rest. We call that hypertension. So we measure your pressures at rest and during activity, they're gonna go high. But some of them go extremely high. The same happens in the pulmonary arteries. If I exercise, they're gonna go up. But some people go so high that they cannot breathe and the oxygen drops. Is rare, okay? And I suspected that because if you really have lupus, I've seen that in people with lupus. But if you don't have lupus, then it kind of makes me feel like before we actually do that, we probably need to consider that cardiopulmonary exercise test. Because, I mean, I can send you to do a catheterization to measure your pulmonary pressure.
Which I've had before. Like a standard cath.
Well, you know, that was negative, right? Yeah.
Yeah.
We would have to have a exercise cath. But, you know, it's another invasive procedure, and you're basically just wondering why you are short of breath.
Yeah.
So I think the cardiopulmonary exercise test may give you some light, because if your cardiac reserve is good and your lung reserve is good on your cardiopulmonary exercise test, it would basically indicate that you need to kind of get into some sort of rehab program.
Okay.
But at least it'll make you feel better. Okay, my cardiac reserve is good and my lung reserve is good. Your again about the inhaler.
Do you think I can just use the nebulizer versus the inhaler when I do get into like a, you know? Because I just don't feel like the inhaler does anything.
Yes. So the one thing you had, remember, was that you had that methacholine test. So it could be that you just have simply just mild asthma. And you need the inhaler even though you don't feel good with it. Now the question is which inhaler. You try some Brio and it make you cough. But we haven't done other inhalers.
You gave me Advil and Combivent.
Yeah. So why don't we try Dulera with a spacer?
Okay. That'll work.
I mean, we're doing simple things rather than doing some sort of invasive cardiac cath.
Yeah.
I don't think you have exercise-induced pulmonary hypertension.
I honestly think it was the lupus treatments and the infusion. I really do.
But you did have an asthma test that was positive or mildly positive. So you could have mild asthma. A lot of people have it.
Yeah. I mean, I had it as a child, but I outgrew it, as they say.
So you use that inhaler. I mean, you maybe weeks that you can come off of it, and then maybe others that you get a little wind that you start using it every day, and you may notice a difference.
Gotcha.
But I'm going to recommend that you use a spacer. You know what a spacer is?
The air chamber.
Yeah, put it in the air chamber, and we'll use something different called Dulera. I'll bring you a sample.
Okay.
Okay?
Sounds good.
All right, sit over here. Let me go get you a sample. I'll be right back.
Thank you. Awesome.
Okay. So So let me take a listen to your lungs. I'll give you a prescription for the spacer.
Okay.
Deep breath. Deep breath. And you're not wheezing. You sound good to me.
Only time I've had, like, I don't know, it's been like a month ago, where I was like got really short of breath and I was laying down and you could hear like the little wheeze rattle, but that was it.
Use the Dulera, and then you do 1 puff in the morning, 1 puff in the evening.
Okay.
That's the lowest dose you can go.
Okay.
And then give it some time.
Okay.
And if it doesn't get better, we can do the cardiopulmonary exercise test.
I'm just hoping like.
If I was in your shoes, I will get myself a little clean slip and say, okay, I'm gonna stay away from all these doctors. Use a little bit of something for asthma because you may have it, but try to. I wouldn't do the test right now.
Oh, I don't want to.
So, if your symptoms persist, we can do it just to give you an explanation. But I don't think it's gonna show a heart problem.
Yeah.
So, now if you oxygen is dropping, they may want to consider something different. We just have to play it by ear.
Okay.
Okay. I'm gonna put in here. Since last appointment, she had an evaluation by Dr. and was told that she does not have lupus. I'm putting that asterisk in there and caps.
Yeah.
She has stopped all lupus-related medications. Remains with intermittent episodes of shortness of breath and occasional wheezing, right?
Yeah.
Has tried Brio, Combivent, and Advair in the past, although she's not sure they help. She has had extensive testing for her shortness of breath, including, and I put here, BQ scan that was normal, right heart cath that showed no evidence of pulmonary hypertension. You did have a methacholine. You stopped the belimumab. Remains having okay. I mean, okay. Stop the CellCept. Okay. All right. Okay. I think that's good enough. Find me later, and then I'm gonna put in here. Here your immune panel was. Oh, remember you got that little. Did we give you a pneumovax?
Mm-mm.
Okay. You had I did a testing in your blood that showed that you had not a great response against some of the common things that can give you pneumonia.
Mm-hmm.
But I don't know if that was related to the all the treatments that we're giving you. So why don't we actually just see each other in 6 months and repeat the testing?
That's fine.
Because it may be that your body was getting poisoned with all that stuff.
Yeah, I believe so.
Yeah, okay. Patient with shortness of breath. Breath is related to mild asthma and component of the conditioning. That would be good for her rather than the alternative diagnosis previously considered. All this other badness. We'll repeat PFTs to double check her DLCO again. Treat exercise-induced asthma or mild asthma with Dulera with spacer. That's it. Okay, let me give you a prescription for that spacer, and then you're all done.
Sounds good.
The NDA spacer. Put Dulera 100, 1 puff BID. Dispatch 1. And you can tell them not to give you the Dulera right now until you try it, but at least you have the prescription for it.
Okay. Thank you so much.
You're welcome. I'll see you. I'll see you in 6 months.
Alright guys, so I'm finally done at the doctor's. 11 o'clock. So I started off, I don't know how much my phone recorded because I got a phone call and it turned it off. But I think it turned it off right at this point of, I saw the nurse practitioner. She was, I told her everything that was going on. And I'm sorry, I went to go talk to my doctor because he was in the office. And so he ended up seeing me. So my appointment went a little bit longer. But I'm thankful because I really wanted to see him anyway, because, you're relaying. But she was super sweet. Nothing like that other one. I'll try to link that old appointment if I can remember which one it is, when I had to see her. So, yeah. Have a new inhaler. It's called Delera. And I'm gonna have to use it once in the morning, once at night. I have to get a spacer for it, which is like the arrow chamber that you attach your inhaler to. I don't think I'm gonna go by there today. I'll probably try to go, I don't know, maybe tomorrow while we're out. I'm just thankful because, she was going over all my meds, and a lot of them, like, I'm not even taking anymore. I'm like so thankful. Oh my God, just you guys just don't know, to be confined and put on all of that medication for so long, and just now my body's just trying to get to whatever normal is, and it is difficult. And I just pray, like, going down the side effect list, a lot of this stuff that I've ended up getting due to these medications, that's the scary part. And I feel like it's negligence on the doctor's part for not doing her due diligence to make sure that you are giving me the correct diagnosis before you pumps me with all of these other medications. And it's just, I don't know. I really don't know, because I can't really say that out of the 4 years, like, that I had times where I felt like okay, like, as far as like, oh, this med I feel like is working, or whatever. Like, it will be times where I like, oh, I think my joint pain is a little bit better or something, but, or my stomach, and it really wasn't. So lots of lots of changes. And I even asked my husband, I was like, should I change my name? He's like, no, because that's what you were going through at that time. He's like, you had no way of knowing, what, the neglect of her doing, you know what I'm saying? So, like, I understand it, but, like, I still have, it's not autoimmune, but I still have, chronic illness as far as the fibromyalgia, and something I have to deal with. But my weight, I was 238 the last time I saw them, and I was 222 today, so I was pretty excited about that. I knew I was losing weight, I just didn't know how much. So, yeah. So I'm going to head to the house and try to tackle the rest of the kitchen. Excuse me. And I think that's pretty much all I'm planning on doing, is straighten up the living room, because I have all my stuff for the GoPro and attachments and different stuff like that. So I have that on the sofa. So that's, I need to tackle, and some laundry. But that thing is so loud. Like, last night I just told him, like, turn it off, because it was like getting worse with the dryer. So I don't know what we're supposed to do when it comes to that. So I'll see when I get to the house, because he was looking up some videos about fixing some of it, or seeing if it's something that was an easy fix. And I have to call Lowe's when I get home, because we have a warranty. I'm not sure if it's still good or not, but I need to call them. So, alright guys, I will come back.